Welcome to today's episode where we'll dive into an essential topic in youth fitness, resistance training for children and adolescents. As more young athletes participate in structured training, strength and conditioning professionals need a deep understanding of growth, maturation, and development. These factors are key to designing programs that are safe and effective while accommodating the unique changes in young bodies. Let's begin with some foundational definitions. In this context, growth refers to an increase in body size or a particular body part. Development encompasses the entire life progression from prenatal stages to adulthood, and maturation is the process of reaching full functionality in both physical and biological terms. Then there's puberty, a transformative period marked by physical and hormonal changes. Notably, these changes vary widely among individuals, with girls typically beginning puberty between 8 to 13 years of age and boys between 9 to 15 years. With youth training, it's crucial to distinguish between chronological age and biological age. Chronological age is simply how many years someone has lived, while biological age reflects a person's development level, often assessed through skeletal maturity, physique, and secondary sexual characteristics. For example, two girls the same chronological age could be vastly different in biological age. One may be fully mature while the other hasn't yet begun puberty. This distinction helps ensure fairness in fitness assessments and athletic competitions, aligning physical ability with each child's development rather than just their age in years. In professional practice, determining a young athlete's biological age can be done through several methods. The most accurate is skeletal age assessment, where radiographs of a child's bones are compared to standard images. However, this method is expensive and requires specific equipment and expertise, making it less feasible for many practitioners. An alternative is the Tanner staging system, which visually assesses secondary sex characteristics. Yet, due to privacy and consent concerns, this method should only be conducted by qualified clinicians. A more practical approach for many trainers involves somatic assessments, where growth patterns are monitored through growth curves, predicted final adult height, and peak height velocity, the age at which a child's growth rate is fastest during puberty. Somatic assessments provide non-invasive and feasible ways to track development over time. Youth athletes display significant variability in readiness for resistance training. For instance, an early maturing 14-year-old girl may be well suited for weightlifting, while a later maturing boy of the same age may not be ready for heavy resistance work. Another critical factor is each child's training age, meaning the length of time they have participated in a structured and supervised training program. For example, a 12-year-old with 2 years of training may experience different gains than a beginner starting at age 10, even with the same program. Practitioners must also assess technical competency, which may differ even among young athletes with similar training experiences. These differences highlight the need for individualized programs that consider each child's maturity, skill, and training history. Coaches should be attentive to psychosocial factors as well, tailoring their approach based on each young athlete's confidence level, motivation, and self-perception in the training environment. One critical risk factor in youth training is injury during peak height velocity, a period when young athletes experience their fastest growth around age 12 for girls and 14 for boys. During these growth spurts, the rapid shifts in muscle and bone structure can lead to muscle imbalances, altered center of mass, and tightness in muscles and tendons. All of these factors increase the risk of overuse injuries. During this time, strength and conditioning professionals should monitor for any signs of pain or discomfort, especially around growth cartilage areas like the epiphyseal growth plates. These growth plates are vulnerable to injury during peak growth periods, which can result in long-term issues such as malalignment or underdevelopment of bones. If a young athlete reports pain, professionals should work closely with parents and healthcare providers to determine if an overuse injury is present rather than dismissing it as growing pains. Youth resistance training should also account for the natural progression of muscle and bone growth. At birth, about 25% of a child's body weight is muscle, which increases steadily to approximately 40% by adulthood. Boys experience larger gains in muscle mass during puberty due to testosterone and growth hormones, whereas girls tend to accumulate muscle at a slower rate because of hormonal differences. Similarly, bone growth occurs in specific areas: the diaphysis or long shaft of bones and the growth cartilage in growth plates. Growth cartilage, in particular, is sensitive to trauma, so excessive loading or poor technique can lead to injuries that may affect lifelong bone health. That's why strength and conditioning professionals must emphasize proper technique and gradually increase training loads, especially during periods of rapid growth. Alongside muscular and skeletal growth, the development of the nervous system significantly influences strength in young athletes. Neural development, including the process of myelination, enables quick, skilled movements and force production. Because motor neuron myelination is incomplete until sexual maturation, children may not respond to training as effectively as adults and may show different skill levels as their nervous systems mature. This neural aspect explains why early maturing athletes often show more physical strength than their later maturing peers. Body types also differ significantly. Early maturing youth often have mesomorphic, muscular, or endomorphic, rounded physiques, while later maturing youth tend to be ectomorphic, tall, and slender. Each body type presents unique considerations for training, as certain builds may have biomechanical advantages in specific movements. Coaches should consider these physical differences when developing training programs and encourage young athletes to focus on individual progress rather than direct comparison to peers. The initial controversy surrounding youth resistance training stemmed from skepticism over children's responsiveness to resistance exercise. Early studies, like those by researchers Ramsey and Doherty, did not show strength increases in pre-adolescents who participated in resistance training. However, these studies faced methodological limitations, short durations, and low training volumes and intensities that likely impacted their findings. As a result, some people concluded that resistance training was ineffective for children, but this oversimplification misses the bigger picture. Given that muscular strength naturally increases from childhood into the teenage years, a more accurate conclusion is that low volume, low intensity training programs may not yield gains above what children achieve naturally through growth and maturation. These findings open the door for further research with improved methods. In recent years, more robust studies have provided strong evidence that children can indeed achieve strength gains beyond natural growth if training intensity and volume are sufficient. Researchers like Feigenbaum, Falk, Carell, and Guy have shown that even for children as young as 5, resistance training can lead to strength gains. In fact, strength gains as high as 90% have have been documented, though typical improvements are around 30% to 40% in untrained preadolescents after an 8 to 20 week program. These gains, however, are not limitless. After an initial adaptation period, children's rate of improvement slows down, emphasizing the need for a progressively challenging training program. The degree of improvement depends on several factors, including a child's biological age, the structure and intensity of the training program, the quality of instruction, and the child's previous levels of physical activity. These findings suggest that effective youth resistance training requires careful design and close attention to each individual's needs. Just as with adults, children experience a reduction in strength when they stop training, a phenomenon known as detraining. The causes of detraining in children are numerous: seasonal breaks, busy schedules, injury, and involvement in other activities can all interrupt training. While adults see a clear decline in strength during periods of inactivity, it's trickier to assess in children because their strength can continue to increase as part of natural growth, even during breaks in training. Studies like those by Feigenbaum and colleagues reveal that children's training-induced strength gains are often temporary and tend to return to pre-training levels without continuous training. For example, Feigenbaum's work showed that children who continued with physical education and sports during a detraining period still lost much of their training-induced strength. Another study comparing 1 day versus 2 days of weekly resistance training found that children who trained once per week achieved only 67% of the strength gains compared to those training twice weekly, indicating a positive relationship between training frequency and strength gains. This insight suggests that continuous training is essential for maintaining the strength advantage achieved through exercise, although balancing training with other activities is crucial. In adults, increases in strength are typically driven by muscle hypertrophy, an increase in muscle tissue size. For children, however, hypertrophy plays a smaller role in strength gains, especially during short-term programs, because preadolescent children have lower levels of hormones like testosterone, growth hormone, and insulin-like growth factor. They don't experience significant muscle growth. Instead, most strength gains in children are attributed to neuromuscular adaptations. Studies by researchers like Feigenbaum, Ramsey, and Falk show that children achieve strength increases through enhanced motor unit activation, synchronization, recruitment, and firing frequency. These neural changes enable children to improve their motor control and coordination, making them stronger and more skilled in physical tasks. Some researchers also suggest that improved motor skills and better coordination of muscle groups play a part in strength gains, making these adaptations particularly valuable for young athletes. The benefits of resistance training extend well beyond strength gains. According to researchers like Kramer, regular resistance training can improve muscular endurance, power, and body composition. This is especially valuable for children who are overweight or obese, as it can help reduce body fat, improve insulin sensitivity, and enhance cardiac function. One of the advantages of resistance training is that it's less aerobically taxing, making it more accessible for children who may not enjoy or excel in more intense cardiovascular activities. In addition to these physical benefits, resistance training can support injury prevention. Feigenbaum and Kramer's research shows that participation in resistance training can reduce the risk of injuries in both sports and recreational activities. In fact, over 50% of overuse use injuries in children might be preventable through well-designed training programs, proper conditioning, and balanced activity schedules. So for young athletes, resistance training is a critical element of preparatory conditioning, helping them build a strong foundation to handle the demands of their chosen sports. Despite the growing body of evidence supporting youth resistance training, some misconceptions persist. One concern among parents and coaches is that resistance training may be dangerous for children. However, studies show that when properly supervised and appropriately designed, resistance training programs are generally safe for young participants. Injuries in these programs are often linked to improper technique, lack of supervision, or poor program design rather than the activity itself. Another misconception is that early specialization in a single sport is the path to athletic success. However, researchers like Malina and Cote caution that young athletes who focus on one sport too early may experience muscle imbalances, overuse injuries, burnout, and even early dropout. Studies suggest that exploring a variety of sports in childhood may actually lead to greater success in the long term, allowing children to develop a wider range of skills and better physical literacy. Designing effective resistance training programs for youth involves several key considerations. First, there is no minimum age requirement for starting resistance training, but emotional maturity and the ability to follow directions are essential. Professionals working with youth should have strong technical knowledge, patience, and the ability to communicate clearly. They should also emphasize technique and safety, focusing on steady progression rather than immediate increases in weight lifted. When assessing a child's strength, some coaches may use one repetition maximum 1 RM testing, which has proven safe when properly supervised. However, alternative methods like jump protocols or hand grip strength are also effective and may be better suited for young athletes, as these tests are simpler to conduct and correlate well with overall strength levels. Proper progression and individualized training logs can help each child understand their personal growth without encouraging competition among peers. For young athletes, training should also include ample time for recovery, as research shows that a combination of active recovery and cold water therapy is often more beneficial than passive stretching alone. In summary, research supports that children can gain strength beyond natural growth with well-designed resistance training programs. These gains primarily result from neural adaptations, which make young athletes stronger, more coordinated, and more skilled. Resistance training also offers numerous health benefits, aids in injury prevention, and serves as a positive and enjoyable introduction to physical fitness. Strength and conditioning professionals play a pivotal role in helping children safely engage in resistance training, fostering positive experiences and lifelong fitness habits. By focusing on gradual progression, sound technique, and individual needs, we can ensure that young athletes develop safely and confidently,